In this next section, I'm going to run through some specific cases about soft tissue infections that you need to be aware of. Vibrio, which you heard earlier when we were talking about Vibrio cholerae in the diarrhea section, is found especially in shellfish. But there's a specific kind, Vibrio vulnificus, that causes large hemorrhagic bullae, followed by necrosis and lymphadenopathy, and actually can lead the patient to become septic. Patients who are immunocompromised or have chronic liver disease are especially susceptible. Another bacteria you need to be aware of is Mycobacterium marinum. This is your fish tank bacillus. It causes non-healing skin ulcerations in people who work around fish tanks. Lesions tend to kind of localize towards the distal extremities because the organism does not grow well at body temperature. A diagnosis for it would be to look for acid-fast bacilli in the lesion biopsy. Typical treatment includes ethambutol and rifampin or clarithromycin and rifampin. Sometimes surgical debridement is necessary. This next one is a mouthful, so I'm going to try to pronounce it slowly. It's Erysipelathrix ruseopathii. This is another cause of skin infection in people who fish or handle other kinds of meat. It's gram-positive and an anaerobe. You treat with penicillin or amoxicillin. Of note, it's resistant to vancomycin and trimethoprim sulfamethoxazole. People often ask when they should give antibiotics for cat and dog bites. They should give antibiotics if it's a moderate or severe bite wound, a crush injury, a puncture wound, which is most cat bites, facial bites that are deep or surgically closed, hand and foot bites, genital area bites, bites that may have penetrated periosteum or joint capsule, and a child that's immunocompromised. Besides Pasteurella, Staphylococcus aureus is a likely organism, so most people recommend amoxicillin clavulanate as the drug of choice for bite wounds. If they're allergic to penicillin, you want to use an extended spectrum cephalosporin or Bactrim plus clindamycin. Human bites, the main organisms are Streptococci, Staph aureus, Eikenella, and Haemophilus species, as well as anaerobes. You must treat all human bites with antibiotics.